Good evening, everyone. I'm Victor Gordlo. Have the tremendous honor of serving as your mayor, and I want to welcome everyone to a community meeting. Before I say any more, let me introduce my colleague on the City Council and the District 5 Council member, Jess Rivas, who's here and will say a few words. We're here for a couple of reasons. First and foremost, we're here to give everyone an opportunity to hear the facts involving what some of the activity that's recently transpired, not just in this neighborhood, but throughout Pasadena. And we'll hear from our police chief, we'll hear from our city manager, and of course, we'll also hear from Dr. Go, because we still have COVID to think about. And so before I go any further, let me just say to all of you that I'm very confident that our police department, that the staff here at Villa Park, the staff at Jackie Robinson Park, and also La Pintoresca Park are doing all that they can in order to avoid more incidents such as the horrific incident that we saw this past weekend involving a young man, a child, 10 years old. And so have confidence that your police department, that the staff at all of these community centers is doing all they can to avoid any more incidents. And you'll hear a little bit from Brenda Harvey Williams, who is going to talk about some of the programming. This is going to take a community effort. It's going to take an effort on the part of all of us to work together to ensure that if we see something, we say something, to ensure that we encourage young people to get involved in some of the programs that we'll be offering and will continue to offer at our community centers. So with that, let me turn it over to Council Member Jess Rivas, who's going to introduce our city manager and who will then introduce Brenda Harvey Williams, as well as our police chief, John Perez. At the end of their presentations, I will then come back together with Council Member Rivas to take questions from all of you. Some of you have submitted questions in advance and we'll answer those, but you also have an opportunity to submit questions and we'll try and get answers to all of the questions as they come in. Thank you very much. Councilmember Rivas.
Well, thank you, Mayor, for that warm welcome. We'll hold on for a second. Looks like we have an audio issue. But this is my opportunity. I know we're really hurting right now, and as a community, but this is my opportunity. So I want to share a little bit about myself. I live in the Washington Square neighborhood with my husband. We've been there for about 5 years. We have a 1-year-old daughter, and we've been active in our neighborhood association since we moved in. And I've been active on city commissions. I've been a commissioner on the Commission on the Status of Women for about 3 years, and then most recently on the Northwest Commission. And I'm also a lawyer. I currently work with the Los Angeles County Counsel's Office, and I've also served as a judge advocate in the Army Reserve for about 9 years. Actually, I'm no longer in the Army as of Monday, so that's brand new. I just got out. The other thing I think it's important to share about myself and that you should know about me is that I come from a family of immigrants. My dad's from Guatemala. My mom's family is from Mexico and Brazil. My husband's parents are from Mexico, and they all came here looking to make a better life for themselves and their children. And they were able to do that with a lot of hard work and with the opportunity they found here. And so I was able to grow up having all the things a child should have: good schools, clean air, clean water, and safe neighborhoods. I went into public service because I wanted to make sure that everyone has those things, no matter where they come from, where they grew up, or how much money their parents have. What we've seen over the last months and most recently this past week has been horrific. No child should be shot playing in their own yard. No parent should have to worry about their children being shot in their yard or in their parks. We should be able to use our parks and walk through our streets knowing that we're safe. So I'm angry. I'm angry that this keeps happening, and I'm scared, that it could happen again. But What I do know is that we are also seeing part of a broader wave of violence that extends beyond our city. And it's been hard to get through. And we are doing our best right now to make our way through it. And I know we're being hit the hardest right now at this moment. And so I want everyone to know that it is my top priority to make sure that we right here in this park, in this neighborhood, and throughout the district get all the resources that we need. Now, it's a little hard to get to know you all through an online virtual Zoom meeting. So something that I'm going to be setting up so that you can get to know me better and I can get to know you is regular office hours. The plan is for me to be in different areas throughout the district, perhaps right here in Via Park and through other parks and other parts of the neighborhoods. So you can just stop by and say hello and share with me your thoughts and concerns and tell me what's on your mind. And there won't be any specific programming or agenda. It's just free form. You can just stop by and for as long as you'd like. The other thing that I understand is that not everyone can come to these town halls or even to the office hours I'm planning to set up. And so I want to make sure everyone can reach me at any time. So please, if you have a pen or you've got your phone out, I'd like to hand out my cell phone number. So I'll wait 1 second for that. So my number is 626-298-5120. One more time, it's 626-298-5120. So please don't hesitate to reach out, shoot me a text, give me a call, or we can set out another time to chat. The last thing I want to do is introduce my district representative, Margot Morales. I don't know if is she around? She stepped away. Oh, she stepped way over there. Many of you may know her. She worked for many years with Margaret McGosson. Oh, here she is. And so I wanted to give her a chance to say hello in case you haven't met her yet. Hello. So we are very lucky here in District 5 to have her. She is a wealth of knowledge and information about the city. So I look forward to working with all of you, and we should all be grateful that we have Margot with us to help us out with everything we need within the city. And I believe that's it, unless you wanted to say anything else. All right. I'm going to hand it off to our city manager, Steve Mermel. Thank you.
Thank you, Councilmember Rivas. With the new council member being appointed, the council is full with all members under the leadership of Mayor Gordo. And while it's a difficult time with all the various COVID restrictions, your city continues to work for you. Sorry. We had planned this meeting before the horrible events of this past weekend, so we have a lot of information to share with you. So I won't take much time because I know you want to hear from Dr. Go and Brenda Harvey-Williams and our police chief as well. But please know and understand that City Hall really does care about you. We're working for the betterment of our community under the direction of the city council. You can reach me at any time. I'm very accessible. You can find me on the city's website or call my office. We want to help you with the issues that you're facing. We know that people are struggling. The city council has moved forward in a number of areas to help our residents get through this difficult time. Our focus tonight will obviously be very much around public safety, but public safety is a very broad term. So in a moment, you'll hear from Dr. Go to talk about how your public health department is working to keep you safe by providing the COVID-19 vaccine. I will be around. I know we're getting some questions and we'll try to answer those as well, but I just want to thank you all and let you know that we're a resource for you. So now I'm going to switch it over to Dr. Go, who is with us remotely.
Hello, it's great to be here with you. And I have some slides to help provide some COVID vaccine information. And can we put those up?
If you have questions for Dr. Go after her presentation, please insert them in the chat and we'll see if we can have them answered for you. Dr. Go?
I will just start while we're waiting for the slides to say that we are in a very hopeful time in this pandemic because we have the incredible scientific technology that is highly effective and highly safe in a very fast time period, faster than we could have hoped and more effective than we had hoped, in the form of 2 vaccines and more hopefully on the way. And I'd like to walk you through those. Let's see if they're, are we going to make any progress on this? Yes. Thank you. Next slide, please. So this is some of the data that you'll find on our website that shows really a very positive trend. But I do want to help provide some context for this information. This curve here that you see shows a downward slope, and it really represents a drop in our daily number of new COVID-19 cases. And the color coding refers to the state's health orders on where our jurisdiction falls as far as what restrictions apply to try and keep COVID disease transmission as low as possible, but affects our school openings, our business sectors that can be open, and the way that we can operate, and the amount of risk that we can take given the current case rates. Because we have dropped significantly, but you will note that we're still not quite at where we were even at the beginning of the surge. We're still at a fairly high level, but I anticipate, as long as we continue to do the things that we're doing, which is not gathering, wearing high quality face coverings, and following all the orders and the precautions, that we hopefully will continue to see this decrease, with some other factors, of course, with some new variants coming through that might be a little bit more transmissible, but we hope that we continue to see this drop. And so we are progressing with some things like opening K through 6 schools, and having our outdoor dining operational again. So those are really positive. Next slide, please. So this is a list of some of the top contenders for vaccines in the United States. You can see the first 2 in the purple box are the Pfizer and Moderna vaccines. We, as our local health department, receive both of these vaccines. They are both 2-dose vaccines and both highly effective, with 95% efficacy as measured in the clinical trials. We will see what the real life efficacy is as we collect more data, but this is a really positive result that they found in the studies. And both studies included a significant percentage of participants in proportionate percentages from different race and ethnic backgrounds. The 2 doses are either 3 weeks apart or 4 weeks apart. However, there is no maximum duration of between the 2 doses. We strive to get the doses for folks at the prescribed time period, because that's the data that we have as far as their efficacy. But as you've heard from the CDC, even up to 6 weeks is acceptable at this point. 2 other vaccines, the Oxford AstraZeneca is also a 2-dose vaccine that is currently being studied in the United States, but approved in some other countries for emergency use, and the Johnson & Johnson vaccine, which is a 1-dose vaccine, although they are doing research now to study what the efficacy of a 2-dose regimen would be for the Johnson & Johnson vaccine. This is up next in terms of the FDA meeting on February 26th. And shortly after that, if it's approved, the CDC Advisory Committee on Immunization Practices will also meet. And this is also a very highly effective vaccine, and only 1 dose, which will really help us with getting more vaccine to more people more rapidly. The effectiveness of this, or the efficacy of this vaccine, was 85% against severe disease, and overall 72%. And one thing to keep in mind is that the data from the Pfizer and Moderna trials is really reflective of the variants that were circulating at that time, a few months ago, starting last summer through November, and may not be as reflective as of the new variants. So there are some variables as far as efficacy. And when people ask, should I pick one vaccine over the other? The answer is no. Please get whatever vaccine that is approved, that's safe and effective, that you have access to, and get it as soon as possible. Next slide. So you'll find on our website the prioritization of who is eligible for vaccines. And this is really only the case because our supply of vaccine continues to be extremely limited. Our goal is to get vaccine to everyone who wants it, But for now, we are still vaccinating phase 1A, which is healthcare providers providing direct care and residents and staff of long-term care facilities. And next slide. We have also been vaccinating all Pasadena residents ages 65 and older, and made a little bit of headway into our first responders, police and fire. Up next are several other groups of essential workers. This is a prioritization that was a framework that was provided by the CDC after careful consideration of risk and also equity factors, and then also required by the state and is required of local jurisdictions to be following this prioritization. It is required of healthcare providers who have medical licenses in California that they are required at the risk of losing their license to follow this prioritization as well. Next slide. And so this is still up on our website, but it's really up in the air. As you've been following, there have been changes and there have been announcements, for example, by the governor about individuals ages 16 to 64 who have comorbidities or certain health conditions who might be eligible in March. However, it's all dependent upon having much more vaccine supply. So we'll see how that goes. Next slide. This is a place where if you are a Pasadena resident and you are 65 and over, please go to our website or call our Citizen Service Center to make sure that we have your contact information. As vaccine becomes available to us, we make it available to you, and we will reach out to you to make sure that you are offered an appointment. Next slide. So this, the framework for where you can access a vaccine has been evolving over the past weeks, and it's changing and improving every week. So I wanted to give everyone an update. Initially, when we were vaccinating healthcare workers, we were mainly utilizing our partner, the Huntington Hospital, and also some healthcare providers and urgent care facilities and other facilities who could vaccinate their own staff. In addition, multi-county entities such as Kaiser and Dignity Health and other healthcare providers received their own allocation and were vaccinating their own healthcare staff. And the other symbol for the healthcare, for the doctors, we were initially, we did allocate to many providers in the city. There are 45 that are approved and 22 that we allocated to. However, our doses were really, amounts were so low that most of them have already completed all of the vaccine that they had and are completing their second doses for the small numbers of individuals, of patients that they were able to vaccinate. We're not sure if your doctor or those doctors will be able to get more supply because of some of the changes in the way the state is allocating doses in the coming weeks. The final symbol in the yellow box is for federally qualified health centers. These are community clinics, and the federal government has implemented a few new programs. One of them is direct allocation from the federal government to our community clinics. In Pasadena, we have ChapCare and also Wesley Clinic that are FQHCs, and they are eligible for direct shipments of vaccine from the federal government. And so that augments the amount that we're getting and does not take away from our local health allocation. In addition, there's a new federal program at 4 Rite Aids in Pasadena and also a CVS in Pasadena, where they are getting direct federal allocation as well. And they are accepting appointments for people who are qualifying in the state framework right now, those 65 and older, and also healthcare workers. In addition, we have partnered with other local pharmacies to give them our some amounts from our allocation to also vaccinate those folks. You know, in the green box, we anticipate partnerships with employers such as grocers and other large employers who can help ensure vaccination of their own employees as they become eligible. And also, finally, in the purple box, the public health system. So our health department has been vaccinating as quickly as we're getting vaccine and trying to really ensure equitable access. And we also need your help to do that. to make sure that any Pasadena resident who's 65 and older who doesn't know how to access vaccine gets in touch with us, because we will help to ensure access. In addition, there's a little icon here of the White House, and that is the final new federal program that's bringing federal allocation into our region. And that is a new site at Cal State LA that is operated by FEMA and by the federal government, and bringing in additional supply of vaccine. And the state as well has stood up another site at Pomona that is separate from LA County. It is also a state-run site and state allocation of vaccine. So all of these different new infusions of vaccine are moving us in the right direction. Next slide. This is our vaccinations dashboard. You can find this on our website, and it just indicates, gives you some information to show the kind of progress that we're making. I actually can't see this, hang on. So you'll see the number of total vaccines ordered. That is the amount that's allocated to us from the state, and we're taking every dose that they give us. You can see that we explain to you, we can track how many doses have been administered, how many Pasadenans have been vaccinated with at least one dose, and with the total doses administered, that reflects people who have gotten 2 doses. And then we provide the information on how many doses the health department has received, because we can track that, and how many doses we have administered. And you'll see that the margin is extremely low. We just have enough doses on hand to be ready to supply our points of dispensing the next week. Next slide, please. These are some pictures from one of our partners at Vaughn's Pharmacy of a room in the back where they provide vaccination. And also, next slide, their outdoor weekend clinics that they have been operating, again, for those eligible populations, and they've gone very well. Next slide. We have conducted, as a health department, strike teams to our skilled nursing facilities and congregate living facilities that have been highly impacted by this COVID pandemic. And also for our healthcare workers and first responders at the fire department, for example, on the right. Next slide. These are photos from our drive-through point of dispensing. We call it an MPOD, or medical point of dispensing, with staffed with nurses, with city staff, volunteers, and administrative staff. It takes at least 50 people to run an 8-hour clinic in this location, but we can vaccinate 200 people an hour. And if you think about it, it's really, and I think it's amazing that we are administering medical care. It's a vaccine. It's not a swab or a test. We're administering medical care outdoors very efficiently, very safely. We monitor people for either 15 or 30 minutes, depending on their history of allergies. And we have medical backup on site as well. Next slide. Currently, we have moved from this location, which was at Victory Park, to our partner, who is generously providing a location at Pasadena Community College, and is going very well. Next slide. So I just wanted to mention that we have launched a outreach plan and an outreach committee with over 32 community-based organizations who are working with us to provide focused messaging to the populations that are eligible for vaccine, to provide timely communication with the general public, to monitor the data and improve our processes to make sure we understand who's getting the vaccine and who needs better access to the vaccine. And then to hold our efforts accountable for equitable distribution, particularly for populations who have been disproportionately impacted by COVID-19. Next slide. These are just some of the logos from some of our partners who are participating either on our committee or who are helping to provide outreach and actually provide vaccine at community sites, or also who are providing information to those and doing outreach to really share information proactively with people who might not otherwise have access. Next slide. And this is some of the information that we provide. I wanted to just highlight here that as you prepare, as you wait for your turn to get vaccine, the state is transitioning to a new process. Right now, there's a way to sign up an interest form on our website if you qualify. But we are going to be switching over in the next few weeks to the myturn.ca.gov website. So you can go there now and you can look at it and you can sign up, and it will ask you questions and it will help determine eligibility. But know that it's in transition and it will be up and running in our jurisdiction in the next few weeks. Next slide, please. So in the meantime, before we get everyone vaccinated, we still have to follow the 3 Ws. And so that means wearing a face covering. I wanted to highlight that in the media, we've heard a lot, and the CDC has updated its guidance on face coverings. There are better quality face coverings that you can wear to protect yourself and protect others that include multiple layers, a good seal and fit around your face, and at the most fundamental level, just making sure that it's covering your nose and your mouth at all times. And then to wash your hands and to watch your distance, to avoid mixing and gathering, and stay 6 feet from others. Next slide. So this is the last slide, just to show our website as a resource. The CDC has so much information, and it's constantly being updated with the latest science. And then the myturn.ca.gov website, where you can visit for information, but also to sign up for that. And that's all.
Number of questions come in for you while you were speaking. So they've been sent directly to you. Let me know if you're able to see those and just run through them. If not, I can read them aloud for you.
Let's see. Let me sort through and see which ones are vaccine related. And if you see any, you can read them out too.
Yeah, and we sent them to you. We texted them to you so that you
Oh,
can
okay.
have them
Let me
all
check my phone.
separate. Yeah, addressed to you. But let me know. I can read them too.
Yeah. Let's see. It's that there's the one question about community gatherings that are being observed at Villa Park. We encourage you to call the Citizen Service Center if you have any complaints about gatherings that may or may not be permitted under current orders, because we do have a team who can help respond to that. There's a question about whether, are there plans for more testing availability? Yes, the state and we're partnering with the county to continue to build out testing. It's still very important, and it really is what informs us to stop the chain of transmission so that we can identify when people have COVID and stop spread. And so it's really important. The testing, the push right now is for testing to support our schools as they open. So there's free testing at the state laboratory that we have connected Pasadena Unified School District with, so that they can comply with the recommendations on weekly or every 2-week testing for routine surveillance testing for students and staff. And that's being made available for free by the state. Are caregivers of elderly, senior, and adult children eligible to receive vaccine? So all home health staff who are employed by home health agencies, for example, who are professionals, are eligible right now for vaccine. If you are a caregiver and have through a regional center, you are also able to get a letter from a regional center that with your name on it and the description of the care that you provide to certify that you are eligible under Tier 1A, and that will be acceptable for vaccination right now. Let's see, vaccine distribution to target Latinx and African American residents in districts 1E and 1 and 5. So we are absolutely trying to reach populations, as we know that the burden of COVID-19 as far as morbidity and mortality has been disproportionate for Latinx and African American populations. We had a very successful community vaccination clinic on Saturday that was a partnership between Huntington Hospital, the NAACP, and our city staff, not just the health department, but the Citizen Service Center and the Recreation Department deserve a lot of credit for making phone calls and doing outreach and signing people up for appointments. So over 100 people were vaccinated at the NAACP this weekend, and we are looking for all opportunities to continue these kinds of vaccine clinics that people that might increase access to our African American and Latinx populations. We are also working with Endalon right now, our day labor organizing network, to try and establish a clinic for in the coming week or two as well. Let's see, will community centers such as Villa and Robinson be used for vaccination sites? We are considering Villa Park as a location. We want to place our vaccine locations at the most convenient locations for community access. And so we are asking our community-based organizations and community members to give us that input for what will work best for them. And that's all I have.
Looks like there was one more question earlier up asking if PUSD staff will be prioritized.
So we have been working very closely with PUSD, and they have, with support from us, but they've organized all of their clinical staff, their nurses, to be able to receive, store, and administer vaccine for their list of teachers and staff who are going to be providing in-person services. And so they've already prioritized their staff who are 65 and older, not based on residents. We've supplied them with 500 doses at this point, but we are anticipating as we finish our second doses the next 2 weeks, if we continue to get a steady supply of vaccine from the state, that we'll be able to expand to early childcare providers, teachers, and we hope food and restaurant workers as soon as possible. It all depends on vaccine supply, but PUSD is well poised to be able to vaccinate their staff.
It looks like we just had 2 more questions, Roland. The first one is about reaching our unhoused neighbors, and then the second one is about whether nannies would be qualified as childcare workers when they're eligible for the vaccine.
Great question. So we have already had a vaccination clinic at Jackie Robinson Center for many of our homeless seniors who are experiencing homelessness, and we'll look for opportunities to continue that and to partner with Union Station as well. There are other supportive housing facilities that we will be partnering with to offer vaccine there as well. And for childcare workers, it's going to be difficult to set up a system. And I am really, really hoping for a lot more vaccine because as we get into classes of essential workers we want to vaccinate all of them as soon as possible, it will be harder for us to verify their employment, but also we need to get enough vaccine to vaccinate everyone who works in Pasadena, not just who live in Pasadena. And so right now the state vaccine prioritization does say that both formal and informal childcare providers qualify, but you can imagine it would be difficult to verify. And so we will be working on a system to figure out how we're going to approach this. Right now, our data show that we have 60% of the people that the Pasadena Health Department and other providers in Pasadena have vaccinated are not Pasadena residents. And that's because we've had so many healthcare workers and so many staff at skilled nursing facilities and other assisted living facilities who are not Pasadena residents. And so it makes a very heavy lift for us to do that, but we were allocated enough vaccine at that time to do that. So we will advocate with the state to continue to receive enough vaccine as we move into these categories of workers to be able to offer to folks who both live here, who are residents here, and who work here. That's really what we would like to do.
We're running a little short on time, so one last question came in and then we'll hand it off to the next speaker. How is the Public Health Department monitoring COVID restrictions at restaurants?
There are a couple ways. We are continuing with all of our routine restaurant inspections. So our environmental health specialists are in restaurants to ensure food safety, as we do when we're not in a pandemic. So they do visit restaurants routinely and also observe COVID restrictions and compliance. We also take complaints. So we want to hear from you if you see violations of COVID protocols. We want to work with restaurants to keep their businesses open, but also to keep their patrons safe and their staff. So that's how we do that.
Thank you so much, Dr. Go, and thank you for everyone for sending in your questions. I'm going to hand it off to Mayor Gordo, and who will introduce our Director of Parks, Recreation, and Community Services. Thank you.
Thank you.
Thank you, Councilmember Rivas. And thank you, Dr. Go, for all of the information. Let me just clarify that one of the questions that was asked involved districts 1 and 5, but the question was from the member of the public was 1, 3, and 5. And so all of the information that Dr. Go shared is relevant to districts 1, 3, and 5, and really to the entire city of Pasadena, related to outreach and our attempt to get more vaccine throughout the city, more vaccine into the city so that we can get it throughout the city, to every part of the city. With that, thank you, Dr. Go. And next we'll hear again, what's transpired in the last few weeks, and particularly in the last week, involving violence in the city is completely unacceptable. But as Councilmember Rivas has mentioned, it's part of a regional issue. The Pasadena Police Department, again, is working diligently, not just in the city of Pasadena, but with colleagues in the region to address these issues. But there's also a flip side to it. And the flip side is more programming for young people, more programming for people who may want to participate in positive activities with their families. And so let's hear from Brenda Harvey-Williams about programming in all of our parks, particularly the affected parks.
Good evening, everyone. First of all, I want a correction. If you're watching, on Zoom, my name is listed as Public Health Director, Dr. Ying Go, and I'm not. I'm Brenda Harvey-Williams, as the mayor said, Director of Parks, Recreation, and Community Services. So I did want to just give a quick briefing, because I know many of you want to move on and hear from our police chief on offerings that we do have available in the Parks and Recreation Department right now. Unfortunately, due to COVID, we have vastly limited and restricted the number of things that we can safely do. But we are offering some 7 actually recreation classes right now for children and adults. And these are all meet the health department's COVID protocols. We actually have temporarily relocated out of Villa Park, and most of our classes are taking place either at Victory, McDonald, or Washington Park. But if you do have children who are interested in soccer fundamentals or non-contact boxing, we have a PE class in lieu of at-home school, and some fitness classes. Feel free to contact us. You can either call our department or go on our website, cityofpasadena.net/parks-and-rec. I also wanted to mention that we do continue to provide out of Villa Park some of our community services programs. So if you need help preparing your taxes, you still can receive that service. I also wanted to touch really quickly on some improvements that we have coming to Villa Park. Our Public Works Department will be soon doing some capital improvements. They're due to begin later this year. We're going to be remodeling the pool area. The auditorium there at Villa is getting a remodel, but most excitingly, we're doing an East End remodel. The boxing room and the fitness room are being reconfigured, and there'll be a new entrance there on the east side of the building. We'll get new flooring, locker rooms. So the whole building is going to get a refresh. And also of interest, one of the related items as part of that project is that we also will be installing security cameras throughout the building, on the outside of the building, and in locations in the park. A couple of other things very quickly that we still have available to you. Those are the ROSE program, which is an employment program for youth between the ages of 14 and 24. If you have youth who are interested in participating in that, again, you can reach us on our website or call Villa Park at 744-6530. Finally, we have been partnering with the health department. As Dr. Go just gave an extensive presentation on the COVID vaccine, we have been partnering with the health department in helping identify hard to reach seniors. We actually have called all of the seniors involved in our recreation and our community service senior programs and given them the opportunity to get an appointment for a vaccine. And finally, I just wanted to mention that we've been involved in feeding programs, both with working with local food pantries and shelters, food pantries and food banks. And also we just concluded one program for feeding seniors called Great Plates, but we are also continuing other partnerships we have with the YWCA to provide home delivered meals to seniors. So if anyone is interested in those services, again, please contact our department. You can call us at 626-744-6530, which is the number there at Villa Park, or look us up on the website. And as I mentioned, I don't want to belabor, because I know the vast majority of the questions coming into the chat are related to some of the violence and the things that have been going on in the area. But do know that unfortunately, because of COVID, we can't be providing there at the park a lot of the programming, a lot of the programs that we normally would, but we are looking forward to that day and that time and slowly being able to bring those back. And we're doing that right now with our outside recreation programs that we're able to offer. So I will stop right there. And if you have any other questions about parks, recreation, and community services, if you put them in the chat, we'll be able to answer them. Thank you.
Thank you so much for your presentation. We've sent you a couple of questions that were addressed to you. You should have them on your text. If not, I can read them aloud. Just let me know which one's easier for you. Okay. I'm gonna, oh, go ahead, sorry.
Okay, why were activities moved from Villa? We had a request from a number of our parents to temporarily move some activities from Villa after the last shooting in late November, where the two gentlemen were killed and the third was shot. So what we did was our recreation classes are very short in duration right now because of COVID. They're only 8 weeks long. So we took this modified, shortened winter session and we moved it to the 3 parks I mentioned: Victory Park, Washington Park, and McDonald Park, because our classes are in the evening and they end after dark. So we're looking to move them right back here for the spring session, which will begin in March, which will coincide with daylight savings time, and we'll have more daylight to have our outside classes, because we can only have our classes outside. So they'll be moving back in March. Then please have the farmers markets follow entry protocols. And I'm not quite sure. Oh, I see. I think that has to do with spacing, keeping social distancing, and we will make sure they are supposed to be doing that, but I will definitely make sure that we have some monitors out to ensure that that's happening. And why are cameras just now being installed at parks? That's an interesting question, because some people want cameras in parks. Some people feel that cameras in parks are an infringement of people's civil liberties. So we have to balance that. We're not putting the cameras in the parks just to have cameras in the parks, but in this case, because we're doing some already remodeling Villa, they're going to be security cameras, and we're trying to be very careful not to infringe upon people's rights just to be in the park and not be filmed for any other reason. Will classes at parks be subsidized or made free? Right now, the classes we are offering are at a very, very reduced rate. For the most part, children and youth, the cost is about $12.50. And for adults, it can be, I think it's 45 for adults, but depending on the class, it's cheaper than our normal time. And we do offer scholarships. So if anyone is not able to pay for the classes, we don't generally turn people away, but we'll either try to offer you a scholarship if you apply for the scholarship. If you are eligible for the scholarship, we'll get you set up with a scholarship. And we also have some private funding that's available to us to also assist. Let's see, is the rooftop garden at Villa open? It is open for the members, so they are up there to do their gardening. It's not open to the public. And can fencing around Villa be removed? We need more green space. And not quite sure what, if you're talking about all fencing around Villa, a lot of it is, the majority of the fencing is up by the soccer fields, and we have to have that because soccer balls go flying. We have a lot of kids in our soccer program and they have really strong legs, and the neighbors don't like the balls being, that's a safety hazard to not have the fencing there. So I hope I've answered the questions, but if not, we'll be able to respond to more in the Zoom. So
It looks like
Thank-
one more just came in,
Oh.
and then I think we're out of time, but it looks like the last question is about the farmer's market being moved into the parking lot.
The parking lot there at Villa is so small. We have it in the street, so I can take a look at that. But I think having it in the street actually affords more room for people to spread out. But we'll take a look at that.
All right. Thank you so much. We really appreciate you answering our questions. I think we're going to move on to the next speaker. And so Mayor Gordo will be back up here to introduce them. Thank you.
Thank you, Councilmember Rivas, and thank you, Brenda, for that information. And let me just say that the fencing around the soccer field is also for car safety purposes, but there is additional fencing that has been added adjacent to the field. And Councilmember Rivas and I are talking that through with the city manager, with residents, to see what a long-term solution might be. Next, we're going to ask our police chief to come up and address some of the facts. Now, keep in mind, as Councilmember Rivas knows, and all of you know, the police chief is not always at liberty to share all of the information, but will share the information that is, because there's an ongoing investigation, but will share facts that he can share with the public and not compromise any investigation. At the end of the day, we do want these individuals to be held responsible. And so please understand that the chief is trying to strike a balance between keeping us all informed in the public, but at the same time, recognizing that there is an active investigation. Chief John Perez.
Thank you so much, Mayor. And there's so much to talk about happening at the national level that impacts us locally. The importance of Ms. Harvey Williams and our parks and recs and some of our services is hugely important. I am hoping we continue to push our parents to get their kids into the services, to have healthy outlets and build their good decision-making and be part of the services. That's a big part of recovery from what we're seeing here in the community. In a moment, you'll be hearing from Crime Stoppers as well to help us solve these. It's going to be important for us. I will begin with this. We are in investigation mode to find out who did this horrific shooting of our 10-year-old. It is traumatic for the family, for our neighborhood, and I could tell you for the police department, for us, we feel like we failed the neighborhood. We recovered 300 guns last year. We recovered 50 guns already this year. And the reason why I use that number is to show how many incidents we likely have stopped before anything has happened. Most of these have occurred not too far from here in the general area. It is citywide, but mostly in one portion of the city, which is problematic for us. Most of the guns have come from waistbands and cars, and people have been cooperative, which has been positive. But we'd give up all those guns just to stop this one on Saturday. And we've been in touch with the family, and there's a lot of prayers and support they need. When it comes to the investigation, we are in fact following up on every lead possible. I can't share too much other than to make a commitment. I speak with our homicide unit regularly, our leadership of the police department, and we were on this 24 hours a day right now to find these suspects, and we will. The investigations of today require so much work, so much technology, some of the stuff we don't have here in the city. It requires support. At the beginning of what we saw last year, we saw people not wanting the police to do what we do. We talked about defunding, not doing certain type of policing in our communities. And so I eliminated the gang unit, not because we're not doing gang work, but because we're redeveloping how we're doing it. We are redeveloping something for the future to make sure we could stop this into the future. These shootings have not stopped in my 35 years. Why? These are about socioeconomic issues. We have an area that's hit by poverty, hit by the recession, hit by everything that's going on, that people are worried and scared. And then we have young people that are getting out of jail sooner. There's not a lot of people going to jail for possession of handguns or any other type of crimes right now. So we're challenged with that, but we're doing our best. We're doing our best to rebuild the system. We do need support from both the council, the people in the community, but we will not let you down. We feel that we weren't there the night of the shooting. We wanted to be there. We were there within 2 minutes of the shooting, but that wasn't quick enough. Again, recovering 50 guns this year demonstrates how many other incidents we likely stopped. So I don't want to talk too much about what I think. I want to hear questions so I can be held accountable and answer to the public of what we have. So whatever we might have, I don't know, is anything.
First, the 300 guns that you made reference to and the 50 guns, that's citywide, not in any one neighborhood. Is that correct?
Most of them are from a couple of neighborhoods not too far from here in this neighborhood as well. We have gotten them from around the city, but there's one area that has been plagued more than anywhere else. We've had places where we've had 20, 30 rounds shot more than one time. We have assault rifle rounds recovered. This is happening all over the country. We need our local politicians, our government people, the police department to come together and really work on these issues. So it is about the entire city, but we are worried about what's happening in some of our neighbors here locally.
Thank you, Chief. I'm going to go ahead and read the questions
Yes,
aloud
please.
so everyone can hear them. So the first one is, law enforcement presence has increased in the neighborhood. Why can't it stay at this level always in the parks and surrounding neighborhoods?
Absolutely. And over the last year, we have put a lot of units into different neighborhoods. We have more people assigned to patrol today than ever before. However, recruitment is an issue. We have to make sure we're able to hire quickly. Why this connects, for every 100 people, 150 that apply, we hire one for the police academy. And it takes us a year and a half to get them out. So we do need support at the rate in which we hire and maintain our police officers here. We are at the farmers market. We have put out our mobile command post here in the area. You have seen officers on foot in this general area alone. We've been out about 500-600 times this year alone. It's never enough. There's never enough for us to be out here as often as we can be, but we make that commitment. You've seen us here more lately with the command post and the shooting that happened, but we need to maintain this presence long-term, not just here, but at other neighborhoods around the city.
The next question is from a resident who lives across the street from Via Park. They want to know if any of the perpetrators from the shootings during the pandemic have been found and convicted.
Yes, we have made some arrests of some of the shootings and some of the suspects. And most of the people we do arrest have gang association. This again is falling to the socioeconomics of a community and the people that decide to take a firearm, stick it in their waistband, stick it in the car, pull it out, and then to begin to shoot that weapon. That person's responsible for that act. And so we have made arrests and we'll continue to make arrests. And I hope to report back very quickly. As soon as we do, we try to make sure the media is aware. I have been criticized about putting information out that's scaring the community. So we have to start telling people what we want to see in our local paper and what kind of news you want to hear, because it's important to get the right information out to our residents.
what updates can you share about the current ongoing investigation into the shooting from just a few days ago, and also the murder of the gentleman here near in Beer Park?
All those investigations are ongoing right now. I don't want to tip our hands to anything that we're doing. So please trust. And when I say that we are on this thing 24 hours a day, all resources are on this, and we'll continue to do our work. And I want to report back and be held accountable to making these arrests in a timely fashion at that.
Will the gang unit be reestablished?
The gang unit was eliminated for specific purposes. We heard from, again, from people from the community wanting to be defunded. We heard it from all over. The police officers were being criticized for their lack of policing, or their type of policing, I should say. And some organizations did not want to see that type of police work. So we eliminated our gang unit, and we've continued with our prevention, intervention efforts to prevent those shootings. But we're also out there. We have more units out today than we have in the past year and a half, working on stopping the gang violence. We are redeveloping our approach to fighting gangs. We will continue to do enforcement. You will see enforcement out there. We will conduct our field investigations. That has to be done. We are training our officers well to look for the precursors of gang activity and criminal activity. So we are doing our best for that. So do not think for a moment that because we had pressure from activists and advocate groups trying to get rid of the gangs, the gang enforcement team, that because we eliminated, that we're not redeveloping and doing the work that's important for you. I would not let you down that way.
The next two questions are similar, so I'll read them together for you. What precautions are being taken moving forward here in Villa Park and surrounding areas? And then the second question is, acknowledging crime extends beyond Villa Park, what's being done elsewhere? And in particular, they're curious about Robinson Park.
So we see this activity bounce around when we're about to change time here in a couple weeks. We'll go back to spring and summer hours. It'll be a challenge for us to get our officers into the parks to make sure that we're visible, our units are out there, and making sure that our newest unit, the neighborhood services section, with our bike units and our park patrols, are out there hitting all the parks. We are developing a system. We're spending more time in each park. I do get a lot of pressure from both the council level or from the community to spend time in their parks. So I try to balance all the time into all the parks as appropriate based on both crime statistics and other things that we need to look at to make sure we're in the right places. So if you don't see the policing you need, you could call my office and talk to me directly, or you could email me at jeperez@cityofpasadena.net, and I can get to some of your concerns and make sure we're on top of them.
Thank you. I think that's all we have right now at the moment for you, Chief. Thank you so much. And so I'll hand it back off to, oh, sorry, Chief, one more just came in, so I'll just get this one in. What is being done about the police department with the resources they do have, I guess, with their current amount of resources?
So our current amount of resources that we have, last year we went to a very large restructure of the organization. We redeveloped how we're gaining intelligence and data to make sure we are focused on criminals, career criminals. We are focused on people that are committing our crimes and people that are gang members. That's where our focus should be. The reason we eliminated the gang unit is because the system that had worked for so long, for 3.5 decades, of just putting a blanket over a community to do gang enforcement has not always been successful. It's similar to a gang injunction if you have one in a neighborhood. So we're finding a better way to do these policing efforts. As well, as I said, we have more people out of the patrol division than we've had over the last 10 or 15 years. However, I need to hire behind the positions so it's fully staffed. Our response times to emergencies, to priority 1 calls, it's faster now than it has been over the last decade. We have prevention programs in place that you won't see in other cities. We have bike patrols, and we're using our helicopter and our equipment in the right way. So I know some of these resources are disliked by some people in the community, and I try to balance the concerns and the criticism from everything of a police enforcement to the helicopters. So I know I have to balance both sides of this issue. And so we need to make sure that we have continued community conversations to ensure that we're getting to both issues. I have learned most of the people that wanted the gang unit eliminated were not those that live in the communities that are impacted by it. They live in different areas. So we have to make sure we get the right residents into the right rooms to talk about the type of policing and the type of expectations that they have. So of our employees, we have enough resources. It's a matter of making our reorganization work and pushing forward to make sure we stop this crime and arrest the suspects that are wanted for this.
Thank you again, Chief. I believe now we're going to turn to just general questions that have rolled in. And so I guess I'll start with Mayor Gordo. Would you like me to read the questions that came in? Okay. So let me scroll back up to that. One moment. Oh, I'm sorry. We're going to hold off on the questions or?
Yeah, why don't we go to Natalie and then?
Okay. Mayor Gordo is going to introduce our next speaker. So we'll come back to the wrap around or come back to the questions right after that. Thank you.
We'll come back to the questions, but I think this is an opportunity to introduce Natalie Salazar from Crime Stoppers so she can give you information. If you have any information related to the recent activity or any activity, please use the information that Natalie will provide to report it.
Thank you, Mayor Gordo and Councilmember Rivas. I wanted to let you know that Crime Stoppers is a nonprofit organization that works with all law enforcement throughout Los Angeles County. We do not collect any personal information. Your tips are completely anonymous, and we partner with the city again and Pasadena PD to make sure that they're getting those tips in real time. If you know a crime has been committed and for whatever reason, you do not want to call law enforcement directly, you can contact Crime Stoppers. We have an 800 number, 1-800-222-8477. You can submit a tip online. You can also use our free P3 Tips mobile app. Again, all of your information is anonymous and encrypted. It does not come back to you. This is not like a 911 call. We're not an emergency line. If it's an emergency, we want you to call 911. Otherwise, if you need to remain anonymous, please go through Crime Stoppers. When you contact Crime Stoppers, you're given a tip ID number so that you can follow up on your tip. Remember, we don't collect your name, your phone number, or your IP address. If your tip leads to an arrest, you could be eligible for up to $1,000 reward. This is based on an arrest. No questions asked, and you do not have to go to court. I want to end by saying someone out there knows who's responsible for what's taking place in our city. If you're that person and you need to remain anonymous, please submit that tip through Crime Stoppers so we can keep our community safe. Thank you so much.
Thank you, Natalie, for that information. And I do urge people to provide any information that you may have. Councilmember Rivas, did you want to read questions?
We're going to go straight to our questions that have come in. The first one is for Mayor Gordo. It says gang violence could go down if schools are reopened. Kids need positive influences, coaches, teachers, sports, goals, etc.
That's absolutely correct. Excuse me. And I, at the moment, we are under the state guidelines and can open K-6 schools. And we're asking the school district as well as all independent schools to submit reopening plans so that they can be approved. I'm a firm believer that, you know, our kids at this moment in time need to be back in school. They need to be socializing and they need to be educating. I can tell you firsthand that I've noticed the strain that it's causing on kids of all ages. And so the city manager, Dr. Go, and the city council look forward to working with any and all schools as they prepare all of their reopening plans consistent with the guidelines as laid out by the Pasadena Health Department.
Thank you, Mayor. And it looks like there's a question asking for me to come out and visit Via Gardens. Absolutely. That's all I'm focusing on right now is reaching out to all the different parts of the district, all the neighborhoods. So I will be in touch. And looks like actually we have a number of questions for Chief Perez if he's, oh, he stepped away. Okay. Unless we have any more questions for city manager, myself, or Mayor Gordo. Are there any that you saw for you? Sorry, everyone, we're just filtering through all your questions. Sure.
There's been a lot of questions related to cameras. I know that Brenda mentioned as part of our building security project for this building, we're putting some cameras on the exterior of the building. And I'm also pursuing putting some out into the park to expand our envelope of security in this location. People are asking if we can put cameras in different areas of town, different streets. We do not have a program to install cameras currently. That is something that starting last year, we were beginning to have some discussions. People feel differently about it. Some people welcome it. Some people are concerned about intrusion into their civil liberties. But we all know many individuals have cameras, Ring cameras, and other devices on their homes. If you don't, I would urge you to do that. And if there is an incident in your neighborhood, please contact the police department and let us know if you do have any footage of an incident. It's proven to be very, very helpful in solving crimes. Thank you.
All right, just waiting to get some more questions. It looks like most of the questions we've gone through already. Just give us one moment to filter through the rest of them. Thank you, everyone, for your patience. Okay, here's one that our city manager will take.
So again, I'm trying to look at some of the questions and then paraphrase them down into one responsive answer. People asked, where did the funding for the gang unit go? I'm proud to say that our city council has not made any reductions to public safety, whether it be the police department budget or the fire department budget. What the chief has done is he's reallocated his resources based on what he sees the needs of the department. People have asked, can police officers, when they come to the park, can they get out and can they walk through the park? The chief encourages his officers to do that, but we need to understand that we have a very, very busy police department. They get a lot of calls, and the ability to stop and walk through a neighborhood is often limited by what's going on in the city at that time. So when we get the calls for services, that's where we focus our resources. And obviously a tremendous amount of the resources are being focused currently in this particular area of the city around the Villa Park. Yes, absolutely. The work of the gang unit continues. It's just being addressed in a different way rather than having a particular unit go out, stop cars, and look for people who may fit a particular description. The way that the police department is doing it now is more consistent with what we've been hearing from our community as to what our approach should be. That said, this year to date, we've taken dozens of guns off the street already, and we took hundreds off last year. So the work is effective, but there's still people in our community that are committing terrible violence. And as the chief indicated earlier, we're pursuing them with all of our resources.
That's pretty much it. If you want to, Mayor Gordo is going to give some concluding remarks, and then I will conclude the evening.
Again, this is the activity that we're seeing and we've seen in our community of recent is not limited to Pasadena. It's a regional issue. It's an issue that we're seeing in other cities as surrounding us, Pomona, Los Angeles, even our community here in Altadena has seen quite a bit of activity. And so it's important that we keep in mind what the city manager has said, that the chief's reorganization doesn't mean that the work of preventing violence is not occurring. And so we expect as members of the city council and as a community that these individuals will be brought to justice. That's the expectation. The chief understands that. The police department understands that. And we need to be supportive of their work as they seek out to bring these individuals to justice. At the same time, we need to do things differently. And so you can expect that you'll see programming back at all of our parks, at Villa Park, at Robinson Park, at La Pintoresca Park, as well as all of the parks in the surrounding communities where there's need for more and more activity. Schools also important, and we'll be working with our schools in order to get kids safely back into the classrooms. And then we'll also have new programs that you should be hearing about involving activities, including job training for young people in our community. So with that, let me turn it back over to Councilmember Rivas. Thank you for joining us. We're out, and Councilmember Rivas and I thought it was important for us to be present here at the Villa Park Community Center as we reach out and try and get more information to you. Councilmember Rivas.
Thank you, Mayor Gordo. I want to thank, of course, Dr. Go, Director Brenda Harvey-Williams, our city manager, Steve Mermel, Chief Perez, and Crime Stoppers for joining us tonight and getting us all this information that we need here in our district. Again, I just want to reiterate that it is my goal and my top priority to make sure we get everything we need and that we deserve here in District 5. So please reach out to me for anything, any issues. I'm going to be out in the community. I want to hear from you. I need to hear from you. It's my job to hear from you and understand what we need in our community. And I look forward to working with you all. Thank you again for attending. We appreciate your viewership and we look forward to working with you. Stay safe. Good night.